Hey, my name is Madison, and I'm going to be performing trach care. First, I would come into my patient's room and identify my patient by the two patient identifiers, and then I would verify my physician's orders and the patient's allergies. I would perform hand hygiene, and then I would begin to don my PPE. So first, I would put on my gown, then I would put on my mask, and then I would put on my goggles or face shield, and then I would, after I performed hand hygiene, I would put on my gloves. I'm going to ask my patient to take 5 to 6 deep breaths or pre-oxygenate the patient for 30 seconds. And then I'm going to remove the oxygen source but set it to the side so it's near the patient. And then I'm going to begin setting up my sterile field. I'm going to open my sterile kit away from me and then place my sterile gloves to the side. And then I'm going to take this shiny side down, only touching the 1-inch border. And then I'm going to dump out the contents of my sterile kit. Okay, I'm going to reach around my sterile field when I pour, but I'm going to cover up the label of the sterile saline and lip it into the trash can, and then reach around and pour it into one side. And then I'm going to cover up the label, pour my hydrogen peroxide in the trash can, and pour it into the other side. Next, I'm going to remove this soiled dressing and then discard of it. And then I'm going to take out the inner cannula and place it into the hydrogen peroxide. Next, I'm going to remove my dirty gloves and perform hand hygiene. And then I'm going to put on my sterile gloves. And I don't have much room, so I'm going to put my sterile gloves on right here. Yes, I'm going to put them on right here. Not breaking sterility. Okay, the patient will be in high Fowler's position, and I can then manipulate my sterile field in order to prevent breaking sterility. Okay, and I have my inner cannula, and then now this hand is broken sterility. And I can take this okay, and I broke sterile field, but because I touched the inner cannula, but I would start the procedure over in real life, but for demonstration purposes, I'm going to keep going. Okay, I would discard of that. And then if it has more secretions that the hydrogen peroxide didn't get off, I can dip it into the sterile saline. And then I'm going to dry the inside of the cannula. Nice and good. Throw that away. Dry. Throw that away. Next, I'm going to take a gauze and I'm going to be sure not to touch my gloves or get my gloves wet. And I'm going to form a wonton and dry the cannula off and throw that away. Next, I'm going to replace my inner cannula into my trach. And then, now that this hand is broken, I can dip this into the sterile saline and clean the faceplate. Throw that away. Cleaning around the faceplate and throw that away. And then I can also dry my faceplate with the gauze and throw that away. Okay, next, as long as I don't touch the inner part where the cannula is going, I'm still sterile. So now I can replace the gauze, and I would also replace the patient's oxygen source. Then I can replace the ties, and I would ask the patient to lift their head. Okay, and once I've slip knotted that, I can then take off the old dressing, the old ties. I would gently lift the patient's head. And then discard of that. I would then discard of all of my equipment. I would take off all of my PPE. I would first take off my gloves, then I would take off my gown, then I would take off my goggles or face shield, and then I would take off my mask. And then I would perform hand hygiene, and then I would document the procedure. I would document the patient's response. And then some of the oxygen sources are nasal cannula, and this delivers 24 to 44% oxygen, and it is a low flow oxygen. If the patient needed a less amount of oxygen, you would use a nasal cannula. The simple mask or Venturi mask, it delivers 44 to 60% oxygen, and this would be used if the patient needed a higher amount of oxygen than the nasal cannula. And then the non-rebreather mask, it delivers 60 to 100% oxygen, and this is a high flow oxygen. And if the patient's oxygenation status is declining from and they're on the non-rebreather, then you would need to intubate the patient. Some complications that could happen with oxygen would be oxygen toxicity. Combustion could also happen, and then you could also have oxygen hypoventilation.